Welcome to Study Session 3, Urinary Tract Infections. Introduction. A urinary tract infection, UTI, is an infection that affects any part of your urinary system. This may include any of the following: your kidneys, ureters, which connects the kidneys and the bladder and urethra. Most of the infections involve the lower urinary tract, the bladder, and the urethra. Women have greater risk of developing a UTI than men are likely to. Infection limited to your bladder can be hurting and bothersome. However, severe consequences abound if a UTI spreads to your kidneys. Most UTIs are caused by bacteria. They can also be caused by fungi or viruses. UTIs are the second easily transmittable type of infection in humans. In this study, we will deal into urinary tract infections. Learning outcomes. At the end of this study, you shall be able to 1. Define urinary tract infection. 2. Describe the causes of urinary tract infections. 3. Discuss the management of urinary tract infections. Urinary tract. What is urinary tract? Your kidneys are two bean-shaped organs. They are found in the abdomen on both sides of the spine. The kidneys serve your blood to sieve out excess water, salt, potassium, urea, and other substances, and then the waste products are excreted as urine. These ureters are thin, spaghetti-shaped tubules. They transport urine from the kidney to the bladder. Male urinary system. The bladder is a small balloon-shaped organ sited in the pelvis. For women, the bladder is situated in front of the uterus. In men, the bladder is located just above the prostate gland. The urethra is a tube through which the urine moves to the bladder. The urethra in women is shorter than it is in men. In men, it travels through the prostate and the penis. Risk factors and causes for UTIs. Anything that reduces bladder emptying or irritates the urinary tract can cause UTIs. Many factors can put someone at risk. Bathroom hygiene. Wiping your body from back to front after going to the bathroom can lead to a UTI. This motion do drag bacteria from the rectal area towards the urethra. Gender. Women are more likely to get UTIs. This is because of their urethras are shorter. UTIs in men are less common and more serious. Obstructions. Blockages that make it difficult to empty the bladder can cause a UTI. Obstructions can be caused by an enlarged prostate, kidney stones, and certain forms of cancer. Diabetes. Diabetes may make patients more susceptible to a UTI. Diaphragms. Diaphragms may put pressure on the urethra. This can decrease bladder emptying. Some studies have seen a higher UTI risk in women who use diaphragms. Spermicides. Spermicides can increase UTI risk. They may cause skin irritation in some women. This increases the risk of bacteria entering into the bladder. Loss of estrogen. After menopause, a loss of estrogen changes the normal bacteria in the vagina. This can increase the risk of UTI. Prolonged use of bladder catheters. Catheters are used when someone cannot urinate normally. These thin, flexible tubes are inserted into the bladder. They allow urine to drain into a container. Long-term catheter use can increase the risk of UTI. They may make it easier for bacteria to get into the bladder. Treatment of a catheter-associated UTI may require removal of the device. Symptoms of UTI. Symptoms of UTI depends upon what part of the urinary tract is infected. Lower UTIs are infections of the urethra and bladder. Their symptoms include burning with urination, increased frequency of urination with scant amounts of urine being passed, bloody urine, cloudy urine, urine that looks like cola or tea, strong odor urine, pelvic pain, women, rectal pain for men. Diagnosis of UTI. History and physical exam may suggest lower or upper UTI. Definitive diagnosis requires a clean-cut urine specimen. This is urine collected from the middle of the urinary system. The goal is to avoid picking up bacteria from the skin. A large number of white blood cells in urine. This can signal an infection. Urine culture for bacteria and the cause of infection. It also helps the choice of appropriate treatment. A complete blood count is required if an upper UTI is suspected. People with recurrent UTIs may need to be checked for obstructions. Some tests of this include ultrasound, intravenous parallelogram (IVP). This injected dye allows doctors to see your entire urinary tract. Diagnosis of UTI. Cystoscopy, which uses a small camera to examine the bladder. During a cystoptosis, a small piece of bladder tissue may be taken for biopsies. A biopsy can be used to rule out bladder cancer. Antibiotics are used to treat UTIs. Lower UTIs can be treated with oral antibiotics. Upper UTIs require intravenous antibiotics. Sometimes bacteria develop resistance to antibiotics. Urine cultures can help to select an effective antibiotic treatment. Researchers are trying to develop a vaccine to prevent recruitment UTIs. In the meantime, there are simple steps you can take to help prevent UTIs. womenshealth.gov recommends wiping from front to back after urinating or having a bowel movement, drinking 6 to 8 glasses of water daily, not holding urine for long periods of time, cleaning your vaginal and rectal areas daily, taking showers instead of baths, wearing comfortable underwear, tight fabric traps moisture, wearing underpants with a cotton cord, drinking water after having sex. While these steps are useful, they do not guarantee that a UTI would not occur. End of study session 3. Thanks for listening.